Good morning, Miss Smith. I am going to bathe you. So I'm gonna go grab my supplies. I'll wash my hands and let me close your curtain for privacy, okay? I'll be right back. Close my curtain. I'm gonna go wash my hands and grab my supplies. I wash my hands. I grab my supplies. For now, I'm not gonna grab my water yet. So now that I wash my hands, I am going to put a barrier on the table so I don't get my clean linen dirty. For this skill, you need 4 washcloths, 1 towel, and a bath blanket, and a new gown. Now I'm gonna go put on my gloves, grab my water and my soap. I'll be back. Make sure that the water, and you're verbalizing saying, I'm gonna make sure the water is nice and warm. And you're gonna test it with the back of your hand. Make sure your water is nice and warm. Do not put soap on your water. I grab my water and I got my soap and I have my gloves. I'm gonna adjust my bed to a comfortable position for me. So right now it's at a good comfortable position. Let me position my cold light away from me. For this skill, you're only gonna do face and arm. So we're gonna grab our bath blanket, both to provide privacy for the patient and warmth. So we're gonna cover the patient with the blanket. Okay. Let's get the top linen off carefully without exposing your patient. And you're just gonna roll it at the bottom of the bed. Perfect. Now you're gonna remove the gown. Most likely it's gonna be tied here in the back. Some of them tied on the side. I'm gonna be exposing little by little. Try to keep as much privacy for your patient. We'll do the other side as well. Okay, I'm gonna put these in the hamper, dirty hamper. If your hamper is too far from you, bring it closer to you, closest to you, okay? Closer to you. All right, I'm gonna start with the face. The face do not require soap. My water is clean water, so I'm gonna grab just a clean cloth, rig it. With the corners, I'm gonna do from the corner of the eye out to the side. I grab another corner of my washcloth. I'm gonna do corner of the eye to the other side. I'm gonna do a forehead, and I'm gonna do her chin. Very good. Put it in the dirty hamper. You can use your towel, you can use one of your dry washcloths to dry her face. I'm gonna dry your face, just pat it dry. Kind of same pattern so you remember, and that's it. Perfect. For now, we're gonna do her arm, her axilla, and her hand. So for this one, you're gonna need your towel. You're gonna expose only one arm and her axilla. Axilla is the armpit. I'm gonna put this under your arm, Miss Smith, okay? Very good. Perfect. All right, I am gonna use both washcloths. I'm gonna put in the water. I rigged the first one. It only has water right now, but I'm gonna use soap this time. For this one, you're not gonna do the corners. For this one, you just put some soap. Make sure you get some soapy washcloth, and then you're gonna start with her hand. Make sure that you do all of her fingers very well. All of her fingers, between her fingers. Make sure you do her palm. You do her elbow, her inner elbow, her shoulder, and you're gonna do her axilla. I'm gonna wash under your arm. Very good, thank you. Now I'm gonna rinse it. It's just clean water. Rig your washcloth. You're not doing corners right now, so you're just going to rinse and repeat everything you did. So make sure you're rinsing so she doesn't end up with any soap on her skin. We don't want irritation. Very good. We're gonna rinse the armpit. Very good. And with this towel, I'm gonna go ahead and dry her arm very well. Her hand as well. How is that, Miss Smith? Very good. All right, I'm gonna lift your arm to get this towel from under you. And now I'm gonna put on a new gown. So for this one, if your patient has a stroke, you always use, to put it on, you use the affected side first. So I'm putting this one on, but for now, she does not have any issues. And then we're gonna do, remember, try to expose her one at a time. Very good. If your patient can sit up, then you ask them if they can sit up. Miss Smith, can you please sit up for me? And if she cannot, then you're gonna help them either roll on their side, lift their head, and then tie her gown. Very good. Make sure it's nice and comfortable for your patient. Now I'm gonna remove the bath blanket because now she's covered and she's not gonna be exposed for very long, so she shouldn't be cold. I'm gonna move this a little bit out of the way. It's okay for you to readjust, to move the bed as needed, okay? I'm gonna remove this blanket, put it in the hamper, and cover you up. Very good, how is that? Now I make sure that my bed is back in a safe position to the lowest position possible. Ms. Smith, I'm gonna leave this collide here within reach of your hand. I'm gonna go dump this water. I'll be right back to give you your water. So you're gonna go, you can't see me, but you're gonna go empty the water on the sink. There's no problem. Throw away your chucks. Kind of rinse your basin a little bit. And you can dry it up with a paper towel. Put away your stuff. Take your gloves off. And you can do hand hygiene either at the sink or with some sanitizer. Ms. Smith, I'm gonna lower this table for you. Here's your water if you need some water. And you're done.